For Anesthesia 4005, I'll be presenting the anesthesia cart at the IWK. As you can see on the front, it has a lock and a code system, so only the people designated to use the cart have access. On top, there are the items that are commonly used and are easily accessible, and then there are some items kept in the drawers down below. Some of the common items used for every OR would be gloves and hand sanitizer, which are easily accessible on top. In the front, there are syringes of different sizes. In front of that, there are medication labels and some tape. Here we have a bin for biohazardous materials and a pressure water bag. And on the side of the cart, we have a stethoscope and some scissors and a garbage bin. Inside the top drawer here, I'll just show you it's all spread out and organized by compartments. And here on this side, the medications are divided into compartments. So there's propofol here, some paralytics in this compartment, and above that to the left there you can see they have some vasoactive medications. And on this side here we have sucrose in one compartment, as it is a pediatric hospital. There's Ventolin next to it, some lidocaine, and some sterile water syringes, so all easy access next to the medications. The second drawer here is designated for needles and IVs. There are some tourniquets up front. And as we are a pediatric hospital, we have a topical anesthetic spray for the needles. In the third drawer here is our emergency drawer. So it has some pre-drawn up medications like epinephrine, an IV catheter. Over here we have some blood sample tubes, there's a flashlight above that, and a massive blood transfusion protocol bag. And over to the side here we have some lines for art lines. The next drawer is composed of some catheters, so there's suction catheters of different sizes, feeding tube, the equipment you'd need with that, so there's some gauze. Here we have some lubricating jelly for the tubes, and some eye pads are also here to keep the eyes safe. This drawer is for fluids, so there's plasma lights, NaCl, lactated ringers. And in the final drawer we have some anesthetic gases like sevoflurane, and some equipment for pumps to administer blood and the fluids from up above. So that is a spike. And here's the setup for the pump, the tubing for it, and next to that is the fluid warming device. And the anesthesia cart is here as well, and it has a few drawers of equipment in it. On top there's a cuff manometer to keep cuff pressure safe. It has some blades and handles for intubation. So we have some airway management equipment in this drawer. With here we have some bougies and a stylet. A small one there. In the next drawer we have OPAs and of a bunch of different sizes and masks of all sizes. In the last drawer here is all our endotracheal tubes, LMAs, NPAs. Overall, this anesthesia cart was very similar to the anesthesia cart seen in the video in Module 1. Some key differences include that the anesthesia cart at the IWK has a lock on the front of it, so the whole cart is actually locked, opposed to the one in the video is not locked, but it does have a drug lockbox inside. Another key difference is that this one is a pediatric cart, so it includes some extra things like sucrose and anesthetic topical spray, as well as different sizes for tubes and masks. Overall, I think both carts were strategically made with the goal of both patient safety and efficiency.